Dakota Public Health broadcast. Binge drinking, an important social habit or a dangerous behavior. Many people enjoy alcohol as a safe pastime, but large groups of drinkers can encourage binge drinking, the most dangerous kind, especially underage students. Tonight on North Dakota Public Health broadcast, we will discuss the dangers of binge drinking and a possible solution to this harmful activity, known as graphic warning labels. Can they reduce binge drinking in kids aged 14 to 20? First up, our resident public health broadcast researcher, Erin, with the prevalence of binge drinking in North Dakota youth and the harmful effects it may cause.
Binge drinking is defined by having 5 or more drinks in one sitting once a month or more. In 2009, an article put out by the Bismarck Tribune stated that North Dakota was leading the nation in underage binge drinking. In 2009, researchers found that 32% of North Dakotans aged 14 to 18 said that at one point they had 5 or more drinks in one sitting during the month before the survey. Clearly, this is a problem with our youth. Binge drinking by North Dakotan youth has rapidly declined since its peak in 2009. In 2017, the Youth Risk Behavior Surveillance System reported that only 16% of high schoolers in North Dakota said they took part in binge drinking within the past month. This is a great decline from the numbers in 2009, but 16% of high school students is still a significant amount of youth. What can be done to encourage better behavior? The high school students also responded that 37% of them had been given alcohol from someone else. Clearly, a solution is needed for this dangerous habit. Binge drinking has many harmful effects on the human body and decision-making. These effects are especially prevalent in young adults because a young person's body cannot cope with alcohol the same way an adult's can. Besides the short-term effects and dangers of being intoxicated, there are long-term effects of alcohol on the brain, including Wernicke's encephalopathy and Korsakoff's psychosis. Both of these conditions cause the person to develop mental confusion, paralysis of optic nerves, difficulty with muscle coordination, forgetfulness, and amnesia. Liver disease is also caused by high consumption of alcohol over one's lifetime. While one is under the influence, not only can they make decisions that can affect their life, but they are also more likely to experience harmful falls, burns, and car crashes. Intoxicated people are likely to engage in violent situations, including homicide, suicide, intimate partner violence, and sexual assault.
In order to understand underage youth in North Dakota, we interviewed a student of North Dakota State University about her drinking habits and her views on binge drinking.
No, I'm not a resident of North Dakota, and I'm 20 years old. I'd say on average 3 times a week. I don't really see it as a problem because of the drinking culture that I'm around. I know that there are long-term effects, but I don't really think that they pertain to me right now as a college student, especially because if I am going to be affected by it, a lot of other people are going to be affected by it as well. Yes, I personally have had problems because of the minors. I've had to pay a lot of money, and because of the money I've had to pay, I've had to work a lot more, and that's affected my schoolwork a lot. And also, now looking into the future because of these minors, I'm afraid that future employers aren't going to take me as serious as people that don't have minors on their record.
And how many minors have you had?
I have had 3 in the past year. I definitely think that warning labels would have helped a lot, especially with starting drinking. Like when you first start, no matter how old you are, you kind of just learn from the people you're drinking around. And I know that if you start at college, you're around people that say you need to drink a lot at parties. So I think that having the warning label would definitely help people realize what binge drinking actually does to your body.
What can be done about this misuse of alcohol? Recent studies show the promise of something called counter-advertising, or the use of pictorial representations in reducing adverse behavior. One study said, quote, "Most importantly, we observed that the pictorial health warnings led to increased intentions to reduce and quit alcohol consumption compared to the control conditions. This finding is in line with related tobacco research. The study concluded, quote, "These novel findings suggest pictorial health warnings on alcoholic beverages may be an important way of making the public aware of the health risks of alcohol consumption." Clearly, pictorial health warning labels on alcoholic beverages would discourage drinking across the board, even among underage drinkers. Another study on the FDA's examination of Canada's pictorial smoking warning labels found them to be extremely effective, stating, quote, "Had the United States adopted such labels in the period of 2012 to 2013, the number of adult smokers would have fallen by 5.3 million to 8.6 million people in the United States." End quote. This study shows the beneficial effects pictorial health warning labels have on reducing harmful behavior. They seem to have a deterrent effect. These studies together suggest warning labels would be effective in reducing drinking across the board, and, in effect, also reduce binge drinking among our target population.
Surveys in the United States show that the major barrier to the effectiveness of warning labels was that they were hard to notice and also hard to read. This is why our special report proposes pictorial warning labels to discourage use.
The final barrier is that the solution requires new laws by legislature. In order for the solution to be effective on a state level, it requires the assistance of the state legislature. Concerned citizens should lobby their state legislators in support of putting graphic warning labels of alcohol to reduce binge drinking.
Graphic warning labels have been proven to alter individual beliefs about the harms of drinking. They have also been shown to lower a population's rate of smoking in Canada. This is a strategy that can be used here in North Dakota for alcohol use. Given that information, our proposed approach will target the individual, community, and governmental aspects of the social ecological model.
Adding graphic warning labels to alcohol bottles would be successful in lowering the binge drinking that takes place in college-age students. Hopefully this change in public policy will affect the community as a whole by affecting the community norms and attitudes that are placed towards binge drinking. Showing individuals the true harms of binge drinking could make a positive change in drinking across the community. Clearly, our community here in North Dakota should adopt graphic warning labels on alcohol bottles to help reduce the amount of binge drinking occurring.